Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What is the success rate of Enhertu in metastatic breast cancer? In the DESTINYBreast-03 study in people with HER2-positive metastatic breast cancer, the Enhertu lengthened the amount of time people lived without their cancer getting worse, called progression-free survival, by 72% when compared to another HER2 inhibitor treatment called Kadcyla. In May 2022, Enhertu, famtrastuzumab deruxtecan, was approved to treat adults with unresectable or metastatic HER2-positive breast cancer who have received a prior antiHERbased regimen either in the metastatic setting, or in the neoadjuvant or adjuvant setting and have developed disease recurrence during or within 6 months of completing therapy. This approval broadened the indications for Enhertu to be used earlier in HER2-positive metastatic breast cancer, and it converted the FDA accelerated approval of Enhertu to regular approval. Keep in mind that your treatment results may differ from those seen in clinical studies. It's always best to speak to your healthcare provider to determine the most effective and safe treatment for your condition and your expected results and timelines. Enhertu is manufactured by AstraZeneca and Daiichi SankyoEnhertu studies. Researchers evaluated 2 primary endpoints, progression-free survival and overall survival, in studies evaluating the effectiveness of Enhertu in patients with metastatic breast cancer that could not be removed with surgery or had spread, and who had received prior treatment. They also looked at a secondary endpoint, the overall response rate. Progression-free survival. In studies, living longer without the cancer progressing is called progression-free survival. It is a common way researchers determine how well medicines work. The first time researchers looked at the data in DESTINYBreast-03 in May 2021, they found that 174 of 261 of people, 66.7%, who were treated with Enhertu lived without their cancer progressing or dying. This was compared to 105 of 263 people, 39.9%, who received Kadcyla, adotrastuzumab emtansine, and lived without their cancer progressing or dying. This result was found to be statistically significant, meaning it did not occur just by chance. Median progression-free survival, mPFS, is the amount of time it takes for the cancer to progress in the body or for death to occur in at least 50% of people in the study. In the results in May 2021, the mPFS for Enhertu had not been reached, meaning that more than 50% of patients had not yet had cancer progression or died. Comparatively, the mPFS for people taking Kadcyla was 6.8 months. When researchers looked at updated data in July 2022, they found that the mPFS with Enhertu was 28.8 months. Overall survival. Overall survival is another way researchers look at treatment effectiveness in cancer studies. Overall survival, OS, is the length of time from either the date of diagnosis of the cancer or the start of treatment that patients diagnosed with the disease are still alive. Overall survival, OS, rate is the percentage of people who are still alive at a certain time point after either the date of diagnosis or the beginning of treatment. In the initial review in May 2021, median overall survival data, in months, was not available. In the second review of data in July 2022, researchers found that people receiving Enhertu lived longer than people receiving Kadcyla. In July 2022, more than 50% of all people in both groups were alive. However, Enhertu reduced the overall risk of death compared to Kadcyla by 36%, hazard ratio equals 0.64. Results showed that 170 of 261 people, 65.1%, treated with Enhertu were alive at a median of 28.4 months, while 138 of 263 people, 52.4%, were alive at a median of 26.5 months. The overall survival, OS, rate of people alive at 24 months was 77% in the group that received Enhertu and 70% with Kadcyla. Overall response rate. Overall response rate, ORR, is defined as the percentage of patients in a treatment group who have a partial or complete response to therapy over a certain time period. In studies, It helps to measure the cancer-killing properties of a medicine. In the initial review in May 2021, 83%, 205 of 248, of people receiving Enhertu had their tumors shrink. The overall response rate, compared to 36%, 87 of 241, of the people receiving Kadcyla. In these studies, a complete response meant the tumor could not be seen on imaging tests, and a partial response meant that tumor shrank by at least 30%. Not being able to see the cancer during imaging does always not mean the cancer is cured. Achieving stable disease meant that the tumor size did not increase by more than 20% or decrease by more than 30%. The data showed that 39 of 248 people, 16%, receiving Enhertu and 20 of 241 people, 8%, receiving Kadcyla had a complete response. Also, 166 of 248 people, 67%, had a partial response with Enhertu compared to 67 of 241 people, 28%, receiving Kadcyla. In addition, 37 of 248 people receiving Enhertu, 15%, achieved stable disease versus 97 of 241, 40%, receiving Kadcyla. In the July 2022 assessment of data, 82%, 202 of 246, of people receiving Enhertu had their tumors shrink. The overall response rate, compared to 37%, 88 of 240, of people receiving Kadcyla. The updated data showed that 52 of 246 people, 21%, receiving Enhertu achieved a complete response versus 21 of 240 people, 9%, receiving Kadcyla. A partial response was seen in 150 of 246 people receiving Enhertu, 61%, compared to 67 of 240 people treated with Kadcyla, 28%. In addition, 38 of 248 people receiving Enhertu, 15%, achieved stable disease versus 96 of 240, 40%, receiving Kadcyla. Related questions: Is Enhertu a chemotherapy drug? What's Enhertu used for? What is the strongest chemotherapy drug for breast cancer? Is small cell or non-small cell lung cancer worse? Disease control. In studies, the disease control rate is the percentage of people who have achieved a complete response, partial response or stable disease. At both assessments in May 2021 and July 2022, 98% of patients treated with Enhertu had their tumors either shrink, stop growing, or slow down. Enhertu common side effects in breast cancer studies. All drugs can be associated with side effects and may occur frequently with cancer treatments. However, you may not experience all of the side effects listed below. Speak with your healthcare provider about the types of side effects you can expect and how to manage them. The most common side effects with Enhertu in breast cancer studies, in at least 20% of people, were nausea, low white blood cell counts, low red blood cell counts, feeling tired, low platelet counts, increased liver function tests, vomiting, hair loss, constipation, decreased appetite, low levels of blood potassium, diarrhea, muscle or bone pain, stomach area pain. The Enhertu labeling also carries a boxed warning for interstitial lung disease, ILD, and pneumonitis and harm to an unborn baby, embryo-fetal harm. A boxed warning in the FDA's most stringent safety warning for a medication. Tell your healthcare provider right away if you get any of the following symptoms of lung trouble: cough, trouble breathing or shortness of breath, fever, other new or worsening breathing symptoms, such as chest tightness, wheezing. If needed, effective birth control, contraception, is required during treatment with Enhertu and for a period of months after treatment stops. If you are able to become pregnant, your healthcare provider should do a pregnancy test before you start treatment with Enhertu. This is not all the information you need to know about Enhertu for safe and effective use and does not take the place of your doctor's directions. Review their full patient medication guide and discuss this information and any questions you have with your doctor or other healthcare provider. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.